Living with a Time Bomb. That was the headline emblazoned across the front page of Delaware's largest newspaper, the News Journal, earlier this year. The story underneath the headline went on to describe the fear and anxiety that residents of Newcastle County's Route 9 corridor feel every day as they live in the shadow of chemical and industrial plants. Communities such as Newport, Belvedere, and Southbridge have lived with this reality, with this time bomb, for decades, and suffer from higher cancer rates and respiratory hazards as a result. This is an issue of health, education, but more importantly, justice, both environmental and racial. The justice cannot come as an afterthought, and it has to be at the center of our response. We know that decades of discrimination and environmental racism have resulted in disproportionate numbers of communities of color at the front lines, where they risk significant disparities in health outcomes. These disparities are then passed on from generation to generation. It's past time we break the cycle. Communities like the ones I described in Newcastle County aren't an anomaly. Communities across the country that neighbor industrial and chemical facilities are more likely to suffer from higher rates of cancer and respiratory disease. In these communities, it is often the most vulnerable, including children and the elderly, that suffer the most from air pollution health emergencies. For example, exposure to toxic pollutants during a child's development phase has been shown to cause lifelong health and education problems. And ongoing exposure to toxic pollutants may cause premature death in the elderly population, often due to existing comorbidities. We need to work together to address these health disparities and the impacts. Our first step in protecting these communities is to use our air quality monitors in each neighborhood to identify the pollutants of greatest concern. We cannot address the issue without addressing the problem, which is why we need to have a more robust air monitoring system across the country. That is why today I am proud to join Senator Duckworth and other House and Senate environmental justice leaders in reintroducing the Public Health Air Quality Act, and why I'm also proud to partner with Representatives Castor and Torres and Senator Markey on the Environmental Justice Air Quality Monitoring Act. The Public Health Air Quality Monitoring Act will better inform and protect communities by requiring EPA to enhance and expand its air quality monitoring network, and will ensure that EPA has the resources they need to do it well. And beyond collecting the data, this legislation will help the community access and understand the data. All too often, the communities that live closest to polluting facilities are the last to find out what toxic pollutants are in their air and how these toxic pollutants impact their health. With the Public Health Air Quality Act, they'll be one of the first to know. From enhancing air monitoring systems at the highest polluting facilities to supporting pilot programs for hyperlocal air monitoring projects in under-resourced communities and communities of color, we need to work together to expand our environmental protection infrastructure. Too many communities throughout our country are living with that time bomb, wondering when or if their government will be there to protect their health. Well, today, let's come together to say that we are here to give them the protection they deserve. We are here to hold polluters accountable and here to make our communities safer and healthier. Healthcare costs are impacted, education costs are impacted, but the ultimate cost is the cost of life. Thank you so much for this opportunity, and I look forward to working with the Senate to pass these important pieces of legislation.